I'm Olivia Bongiorno. I'm a nursing student at the University of South Alabama, and today I will be performing a medication administration checkoff. I'm going to start by talking about the no interruption zone policy. That just means to eliminate any and all distractions while performing the task at hand. That means limit conversations with colleagues to essential only, close doors, no phone, and make sure your total focus is on this. And now I'm going to talk about the 5 rights. I'm going to compare the medication administration record to the patient care order form and make sure that everything matches. Jaguar Jones, that is the right name or right patient, and then the medical record number is 417-6352. The medical record number is 417-6352. I am now going to see that heparin is the right medicine. Yes, matches. 5,000 units is the right dose, 5,000 units. The subcutaneously the right route and the right time, every 12 hours. And then I see that he has an allergy to penicillin. He is in fact allergic to penicillin, I can confirm that. I will now sanitize my hands. I will find the right medicine for my patient. Today we will be using 10,000 units per milliliter of heparin. And then I check to see the expiration date. It's December 5th, 2025, so we can use this. And then the patient receives heparin dose every 12 hours, so I look to see that it has in fact been 12 hours, and it has. This is a subcutaneous route, and I will be using this needle and syringe. So I'm going to first, before I do anything, check the math, make sure that everything works. Jaguar Jones requires heparin of 5,000 units, and the heparin in my vial is 10,000 units per milliliter. So I, in my 1 milliliter syringe, will draw in 0.5 milliliters of heparin. And so I'm going to disinfect my vial, discard. I'm going to make sure it is clean, throw that away. I will open my syringe. And then I put that into the Sharps container, and then I will draw in 0.5 milliliters of air because I want 0.5 milliliters of heparin. So I will then place my needle into the vial. I will push in the air, and I will draw out 0.5 milliliters of the heparin. Make sure there aren't any air bubbles. So there's my 0.5 milliliters of heparin. I'm now going to verify with another nurse that this is the right dosage and the right calculations. Once she verifies that, I will then again refer to my medication administration record to confirm that everything is right. I will use my vial and my syringe, make sure that the heparin, so right medication, 5,000 units, right dose, subcutaneously the right route, and every 12 hours, which is the right time. And then I would check that Jaguar Jones is, I would first do that, I apologize. I would first check that Jaguar Jones is my patient at the medical record number 4176352. Medical record number 4176352 matches. I'm now placing my syringe down with the safety cap on. I'm going to now write the patient name, which is Jaguar Jones. I'm going to write the medication, and I'm going to write the dosage. And I'm going to put that on to my syringe, and I will now be going into the patient's room with my medical administration record and my syringe. I enter the room. I'm going to place this down with the safety cap on. I'm going to sanitize my hands. I'm going to see that my patient is Jaguar Jones. That matches on my MAR, the medical administration record. His medical record number is 4176352. That matches medical record number 4176352. That is correct. I see that he has an allergy ban. He's allergic to penicillin. I can confirm that he does have an allergy to penicillin. Mr. Jones, are you allergic to anything else? No? Okay, Mr. Jones is only allergic to penicillin and nothing else. I am then going to check the medication administration record again to confirm that everything is right before I do anything else. Jaguar Jones. He is the patient. We have confirmed this. The medical record number does in fact match 4176352. And now I'm going to see again that it is heparin. 5,000 units, the right dose. Heparin is the right medication, the right route, subcutaneously, yes, subcutaneously, and the right time, every 12 hours. That is correct. I am now going to explain the procedure to Mr. Jones. I'm going to put this down. All right, Mr. Jones, I will be injecting you with heparin. I am going to now raise the bed to a working height. I am going to drop the rails. I'm going to now sanitize my hands again because I just touched my nose. I am going to drop the rails for an easier access to the site and make sure that there's nothing covering the site, of course, before I give the injection. I am now going to put on my gloves and my goggles. I now will assess the route. This is a subcutaneous injection. I will be using the abdominal injection area to give the heparin injection. I will be making sure that it is at least 2 inches away from the umbilicus. So I'm going to take my alcohol pad and clean from the inside out, making sure I never touch it again. Perfect, discard. I will now take my heparin. I will drop the safety on it. I will pinch the skin, and then I will inject at a 90-degree angle. And I'm injecting the heparin. Okay, I will now put the safety back up so I can discard it into the sharps container. I am now going to raise the bed and pull up the rails, all except one for safety reasons. Oh no, I will not raise the bed. I'm sorry, I'm going to lower the bed. Yes, excuse me, I will lower the bed. I will put up the 3 safety rails and I will leave, or the 3 rails, I will leave one down for the safety of Mr. Jones. I'm now going to remove my gloves. I remove them glove to glove, skin to skin, and I'm going to sanitize my hands. I'm going to come back in to reassess my patient, make sure everything went accordingly. Okay, it did. Now I'm going to go document, which is the sixth right, the right documentation. I'm going to document the medical administration record, the MAR, and anything that my patient might have let me know, or anything, yes. All right, so that will conclude my medication administration checkoff.